Let's talk creatine. Creatine is the new supplement that is on everyone's longevity stack. But whether you are on it or whether you plan to be on it, let's understand what the side effects are, whether it's really going to help you, what the correct dosage for the same is. So watch till the end. Now, what is creatine? Creatine is actually a combination of arginine, of glycine, and of methionine. It's naturally made in the body in the dose of about 1 to 3 grams per day, and it's stored in the muscle. Who needs to take creatine? If you're a vegetarian, if you're a vegan, if you're trying to build your muscle mass, if you're trying to increase strength, then creatine can help you. But the effects of creatine are so much more than just muscle mass. If you have leaky gut and if you want to rectify that and repair the gut lining, creatine will also help you. For anyone who's got maybe very high cognitive demand, if you're very stressed, if you've got Alzheimer's, there are studies now to show that creatine may actually help even with these deficits because it actually can cross the blood-brain barrier. Also, if you're a menopausal woman and if you're complaining of brain fog and suddenly just like not getting names right, creatine can actually help you. Let's understand what are the side effects of creatine. A lot of people, especially patients at my clinic, who come and tell me that I've taken creatine, but now I have put on weight. The scale actually moves upwards. This can happen, and this happens because creatine can pull water into the cell. Please remember that this is a very, very temporary side effect, and given a couple of days, you will revert to your normal weight. Also, for patients who have got a lot of hair fall or hair loss, especially when you've got alopecia, there is one study, just one, that was done in 2009, which showed that it can actually stunt the hair follicles and can cause the hair loss. Now, if you are somebody who's already complaining of a lot of alopecia and hair fall, I may not necessarily give it to you, and there are other supplements that we can take. But if not, or if you've got mild hair loss, please continue to take the creatine because that one 2009 study has never been replicated. So what is the best kind of creatine that you should take? There are many kinds in the market, but it turns out that creatine monohydrate is probably the best absorbed, and that is the creatine that you should be taking. In what dose? I recommend 3 to 5 milligram and no more to begin with. Let your body get used to it, let your gut get used to it. And then if you are giving it for a cognitive problem, if you're giving it for Alzheimer's or any other brain related issue, then there are some studies that show that increasing creatine 10 grams, even 15 grams can help cross the blood-brain barrier and help with those symptoms. But if you are trying to use it just for muscle and maybe even for gut, 3 to 5 grams is ample, and that's good enough. If you have gut issues, try and take the micronized form because that will have less GI side effects. Okay, so now that you've decided to take creatine, how do you take it? You take it either during exercise or right after exercise. Much better to take it with electrolytes. This seems to actually help more absorption of the creatine. For a lot of my patients, they take it with coffee and like to chug it down. Bad idea. It can actually increase your GI side effects. So keep a gap of at least 45 minutes between your cup of coffee and creatine, and also sip it. Don't take it in one gulp. Now, there's a common misconception that creatine will increase the creatinine in your blood. Let's understand the difference between creatine and creatinine. Now, I've told you what creatine is. What is creatinine? Creatinine is the waste product that is made when your muscle breaks down. It goes from your muscle into the blood, into the urine, and then gets excreted as creatinine. Normal range of creatinine in your blood value is between 0.7 to about 1.2 to 1.3 if you're a man, and it's slightly lower if you're a woman. So the muscle size, how much, whether your gender, whether you're a vegetarian or a non-vegetarian, all of them will play a role in how much creatinine you have in your blood. So don't worry about it because it can increase a little bit with these differences. Now, when you actually take creatine and you see in your blood value that the value of creatinine has gone up, does this mean that it's affecting your kidney adversely? May not be at all. The test that you need to do here is not creatinine, may not even be EGFR, but a test called cystatin C. It's an inexpensive test. If you feel after taking the supplement You want to be sure where your kidney function is, or if you feel your doc has asked you to stop it because your creatinine level has gone up, just do a cystatin C value, because that is not affected by the creatine you take. That will actually tell you whether you have got kidney dysfunction or whether your kidney is functioning properly. And more often than not, you can continue to take the creatine and continue to get the good effects of this supplement.